An order signed by the Indiana State Health Commissioner is aiming to protect those most at risk during the pandemic.
It comes as data shows about a fourth of Indiana's COVID-19 related deaths happened at nursing homes and long-term care facilities. Demetrius Sanders is in our newsroom. He joins us now with how this order intends to help and how local health officials and staff at nursing facilities are reacting. Demetrius.
Dana, Mike, with COVID-19 impacting nursing homes across the country, Indiana officials are allowing some residents at these facilities to be moved. It's a decision that officials say is meant to ensure both the health of staff and those who call these facilities home. Indiana State Health Commissioner Dr. Christina Box recently signed an order allowing long-term care facilities to transport residents during the COVID-19 pandemic.
This order is intended to allow facilities that already have COVID-positive patients to take others who have the same status so that they can be cared for in a way that best serves our residents.
The order also allows residents who are not COVID-19 positive to be moved to a facility where there is a decreased health risk. The decision comes as on Wednesday, Box reported that long-term care facilities make up around 7% of the state's COVID-19 cases, but are responsible for over 25% of Indiana's COVID-19 related deaths.
It's devastating to see the number of individuals in their facilities that are ill and then sometimes losing their lives to this disease.
In Linton, long-term care facility Glenburn Home has announced that 9 residents and 7 employees are COVID-19 positive with 3 deaths. The Greene County Health Commissioner says the order will assist that facility.
That order came just in time to allow us to cohort patients, to separate patients who were positive from patients who were symptomatic.
And Lewis says she believes the order is necessary to protect those who are most at risk.
We know that long-term care facilities, they house patients, some of the most vulnerable patients we have with this COVID-19 crisis. So doing that was definitely a step in the right direction.
Now, Dr. Box says for a facility to only host COVID-19 patients, the decision must be made with input from local hospitals, local health officials, local public officials, and the Indiana State Department of Health.